Good evening, viewers. In this particular video clipping, I shall discuss about some important matters relating to medical representative's job and relating to our healthcare. So before discussing that matter, I will tell that I must tell you that take care to your babies, the pediatrics, the children, because in this winter season they can have common cold, cough, rhinitis, rhinorrhea, running nose, etc. type of various fever, various types of problems. So in case of this is very common problem in the pediatric patients, in the child patients, that is the nasal problem, the nasal congestion. So you require some nasal decongestant or some inhaler type medicine, that is you can nasal drop, etc. Sometimes the parents will be very much worried about that what they will give particularly to their children, to their baby, that if he or she will suffer from the nasal congestion. That is a very common problem, but that is a very much important problem, a bad type of problem, and this is a very much this gives a highly discomfort to the babies, especially very much difficulties. So to avoid this type of difficulty, when you see that your baby is facing that type of nasal congestion problem, you must keep one little simple medicine in your home that is available just like a OTC product. It is available in the local medicine market, local chemist shops. That is Otrivin nasal drops for pediatric use, definitely. And when you purchase, I do not give you any type of knowledge. When you purchase, you must see from your common knowledge, you must read the cover of the medicine. There it is clearly written that from which age to which age it should be given. Then easily you can give it to your baby. And also you see that many TV channels are showing many medicines that are available, that are OTC. So you do not require any doctor's prescription for the medicines. Another some doctor's prescription medicine that are also available in the chemist shop, that is without any type of anguish, you can use it. Without any type of mental, any type of frustration, you should not be worried when you will purchase the medicine. Just like loose motion, when your baby will face some loose motion, or that is, he will go and he will have the watery stool 2 or 3 times. You do not wait. Only 2 times if you will see the watery stool, and after 1 time also, I think you should not take the risk. You have one suspension, that is the liquid syrup. Suspensions means syrup forms of medicine. So that medicine is called O2. Okay, O2. Basigil is also very much effective, but Basigil is not that available in the local market. I think that is O2 suspension, and there are some doses also you will give according to the body weight. In the next video I will discuss clearly about that again. So you will give that one that is the 1 teaspoonful to 2 teaspoonful according to your baby's body weight. Suppose he is 5 to 6 years old. Also you will give to your baby of 12 years old also, you can give the O2 suspension, that is 2 teaspoonful. That is only once a day it will act like a magic. Otherwise you will just visit a pediatrician doctor, but it is the mild dose. I think in case of loose motion that is not severe, it will act like a magic and it will stop the loose motion. Okay, stop the watery stool. So after discussion of that type of very much important things, then I will come to one important question that is not being asked in the MR interview, but that should be known to every medical representative experienced and also freshers. Because if particularly he is the science graduate also, and non-science graduate also should know it, because it is a very much important question. The question is that the doctor is prescribing antibiotics in case of loose motion, I think the adult patient, to the adult patients. Okay. Then he is prescribing some antibiotics that contains two major ingredients. One is antibiotic and other is antiprotozoal. Why? In case of severe type of loose motion, we are finding that type of incidents. But why? Why he is prescribing both types of ingredients? Antiprotozoal is in case of, it is used in amebiosis, because protozoa oriented diseases is amebiosis is the common amoeba, and also giardiasis also amebiosis is a very common disease, chronic amebiosis etc. But in amebiosis, when antiprotozoal, actually amoeba is a protozoa which causes this type of amebiosis, then why doctor are prescribing the antiprotozoal along with the antibiotic, where antibiotic is a necessary ingredient in case of diarrhea? Antibiotic definitely stops diarrhea, but sometimes, my dear viewers, I will explain in that way that you have seen it, I think, in case of diarrhea or dysentery. Suppose you have got it. After the diarrhea stopped by giving antibiotic, you will face, after stopping the diarrhea within one day, within 24 hours, after that very day, you will face some mud type of stool is coming from you. Mud type of stool and smell from the stool. That is called, that means you have amebiosis then. Why? Before 10 years, when doctors are not prescribing, actually then was not that type of unique combination, etc. Before 10 years, not before 15 years, I think, then it was happening. But after the invention of using two types of ingredients, antibacterial with antiprotozoal, then this is stopped now. Because after stopping the, the diarrhea, after killing the bacteria which causes diarrhea, the dangerous type of many bacteria which causes the diarrhea, etc. Then after killing the bacteria, then also entamoeba histolytica also causes amebiosis. After killing the diarrhea, then who will face, who will war against the amebiosis, against the entamoeba histolytica protozoa and against the amoeba? Then they will giving some antiprotozoal. They are using, the doctor is prescribing, so both the combination drug. So that is one drug is very much useful in the market, moving in the market. That is from the Cipla company, Norflox TZ. Norflox O2 also adult dose. That is a caplet form. That is the caplet form, a long type of tablet, caplet form. So that is the main thing doctors are prescribing. So thank you, my dear friends, my dear viewers. Have a nice time. Good night.